Hi, um, welcome to today's live. As you know, my name is Donna. I'm currently in a place called Loveless UNM Rehabilitation Hospital. I'm working on getting my balance back. I had a kidney infection and it caused some dizziness and upset my medication and things a little bit, so I had to. Hi, Clara. I'm going to talk to you today about some issues that have been going on in Indian country, specifically drug-addicted babies. The first thing I want to point out is, as natives, we are part of a thing called sovereign nation. We are sovereign. So I wrote a paper. I'm going to be reading it off of my Facebook here. I'm not my Facebook, my laptop. So I'm going to be looking here, but also reading. So what is sovereignty? Sovereignty is a form of power that a nation has over itself and its people. There are several key questions that need to be answered in order to understand sovereignty. What is a nation? What is power? And why, because of power and statehood, is sovereignty important? Number one, a nation, by definition, is a nation or territory considered as an organized political organization under one government. Two, power, by definition, is the capacity or ability to direct or influence the behavior of others or a course of events. And why is sovereignty important? Sovereignty is important because it refers to the quality of having independent authority in a specific territory. And up until today, like right now, the focus has been on linguistic reorientation and food sustainabilities and oil and those kind of things. But that's kind of been the focus in all of the issues today. So the focus has been on linguistic reorientation and food sustainabilities within the legal and social sciences. Not much focus has been given on babies born with NAS, and that's Neonatal Abstinence syndrome. The popular sovereignty principle is the underlying idea of the United States Constitution, and it argues that the source of the government power, sovereignty, lies with the people, the popular mass. The tenet is based on the concept of the social contract, the idea that the governing power should be for the benefit of its citizens, its immediate members. Sovereignty can be found in the power to rule and make the laws that depend on political facts for which there are no pure legal definitions, such as an unborn tribal member's right to live and choose life. Like to choose the way he or she wants to live. An unborn baby's right to say no. An addicted mother's mindset on wanting a healthy baby but can't break free from the prison of her vice. So by theoretical thinking or by theoretical practice, sovereignty makes a tribe in its entirety required to exercise and possess a moral value. It's imperative that we have that. An important factor of sovereignty is the degree of absoluteness, because when there is no law, constitution, or custom to restrict or control that government, it contains exclusivity of jurisdiction. Let me say that again. An important factor of sovereignty is the degree of absoluteness, because when there is no law, constitution, or custom to restrict or control it, it contains exclusivity of jurisdiction. So why can't we make our own laws regarding the protection of our unborn tribal members? Yeah, they're not members yet, but they will be. What about our future tribal members? Okay, now back to the NAS problem. The lucky ones are the premature babies. Believe it or not, the premature babies have a lower risk of withdrawal symptoms or have less severe symptoms because they were exposed less to the drug that the mother was using. They also get better faster because they were exposed to less of the drug than a full-term baby, assuming she wasn't using the entire time. It depends on the person because each situation is individual and according. Heroin and other opioids, including methadone, can cause serious withdrawals in the baby. Seizures may also occur in babies born to opioid users. Some symptoms can last as long as 4 to 6 months. Can you imagine a baby having seizures and tremors and suffering for 4 to 6 months after the baby was born? Not including what was going on inside. Yeah, that's not counting what can occur months and even years down the road. NAS babies don't have to be like that at all. This syndrome is a preventable syndrome. We can prevent this. It doesn't have to happen. But it can only be prevented if the mother stops using drugs before pregnancy or as soon as she learns that she is pregnant. In our cases on the reservation, that isn't possible to do safely. The mothers here, in all cases, need close medical supervision. But the laws prevent that from happening. And what I mean by that is that these people are supposed to be, I forgot the word, required reporters. What's the word for that? Where they're required to say what they see or what's going on. So when these laws, when the doctors or whatever they're supposed to report, the mothers who are doing drugs, they don't want to go to the doctors. They don't want to do this because they're afraid of the ramifications or the consequences. So we need to change that. Change not necessarily the narrative, but we need to change the protocols. We need to change the judgments. Because we need to save these babies' lives. It's not the mother that's the important one. Yes, she is important. Yes. But she's not the one we need to fight for and worry about. We need to fight for the babies. We need to fight for the unborn children that are suffering from heroin and fentanyl addictions, opioid addictions. Okay, back to the neonatal abstinence syndrome. Okay, what a baby goes through when they're suffering from NAS is excessive crying or high-pitched crying, irritability, trouble sleeping, excessive sucking, poor feeding, slow weight gain, diarrhea, vomiting, projectile vomiting, seizures, pain, and even death. Stillborn, death. What is it? Sudden infant death syndrome, SIDS, SIDS. There has been plenty of discussion of America's latest heroin epidemic, and it's spreading across the country, particularly ravaging rural areas like MHA Nation Reservation. But far less public attention has been paid to the children born to this epidemic. About 1 in 20 women, 1 in 20 use illicit drugs during pregnancy. In specificity on our reservation, that occurrence is way higher. I'm not quite sure on the statistics. We're working on it, but it's in the single digits, like 1 in every. Just for the story, this isn't true. I will get the facts, but it's like 1 in 5.
That was my granddaughter.
That's horrific. Heroin and fentanyl. I don't even have a word. An existing federal law requires doctors to administer so-called safe care when they identify a pregnant woman struggling with substance abuse. However, that law leaves it up to the hospital or healthcare facility to self-establish what that care is going to be like or what it's going to look like. So that kind of puts us in a little sticky wicket because we're colonized. Don't fool yourself. We colonized now. We have that colonized way of thinking. Oh, what about her rights? What about this? What about, No. What about that baby that can't even say no? That unborn tribal member. We need to stand up for him or her, not the mother, not the father, not their rights. If they really want to worry about themselves, then don't get yourself pregnant. Take precautions. Be a responsible, respectable human being. Problem solved. Or don't take drugs. But since we live in a society where we can't do that, social services. Social services. MHA social services. We'll come back to that one. Okay. So, however, the laws that leave it up to the hospital or healthcare facility to establish what that care will look like is colonized. And because of that, we use state laws. On our reservations, we use state laws in our social service departments, right? I'm pretty sure that we had adopted the United States Constitution. A lot of our tribal constitution is it IRA? I think it's called Indian Reorganization Act. Okay, so back to that. So in general, every place that has struggled in doing these bills, like reforms, resolutions, have been based on that. So as sovereign nations, we should be able to, let me read this sentence here. Okay, so in general, every place has struggled in doing this. Bills pending at the federal level could change by requiring the Department of Health and Human Services to provide a clearer action plan for improving treatment programs for pregnant women struggling with addiction. But we ain't state. We tribal. We're sovereign. Or at least we boast that we're sovereign. Are we really? If we're not really doing anything, are we really sovereign? Prenatal use of opioids causes withdrawal syndrome in newborns, called NAS, which we were talking about. And babies with the NAS are at greater risk of seizures, respiratory problems, feeding difficulties, low birth weight, and even death. Using drugs, alcohol, or tobacco during pregnancy exposes not just the woman, but her developing fetus to the substance and potentially promotes deleterious and even long-term effects on these exposed babies. Smoking cigarettes, let alone fentanyl, can cause stillbirth, infant mortality, sudden infant death syndrome, preterm birth, respiratory problems, slowed fetal growth, low birth weight, seizures, extreme and painful withdrawals. Drinking during pregnancy can lead to the child developing fetal alcohol spectrum disorders such as FAE, FAS, and characterized by low birth weight and enduring cognitive and behavioral problems as well. Now, nearly all addicted individuals believe at the onset that they can stop using drugs when they first start. They all have that thought that, I can quit anytime. This is going to be easy. But we all know, we've seen it. We know the story. Although some people have succeeded in doing that, not just the stories of people falling back into addiction way overpowered people who succeeded in quitting on their own. It always ends up in failure to achieve long-term abstinence. Research has shown that long-term drug abuse results in changes in the brain that persist long after a person stops using drugs. These drug-induced changes in brain function can have many behavioral consequences, including an inability to exert control over the impulse to use drugs despite those adverse consequences, despite knowing they're creating a whole new life, that they're responsible for that. And they don't have consent. Once they're an addict, they don't have consent. And that right there is the basis of our issue. That right there is the defining characteristic of addiction. Research has established the value of evidence-based treatments for pregnant women and their babies, including medications. For example, well, there's no medication that the FDA recommends to use during pregnancy, but there are opioid approved protocols like methadone, but the outcome is the baby still has to have withdrawal. It still has to go through a drug withdrawal program treatment as an infant. And understanding that addiction has such a fundamental biological component may help explain the difficulty of achieving and maintaining abstinence without treatment. This physiological stress from work, family problems, psychiatric illness, pain associated with medical problems, social cues, such as going to the bar, hanging out, going to a party, individuals from drug using past, environmental cues such as encountering streets, objects, parties, smells associated with the drugs can trigger intense cravings without the individual being consciously aware of that trigger. Just because you say you don't want to do it, but you can smell something, you can see something, you see somebody, whatever, and it triggers you back into that mindset. So it's so easy to relapse. Nevertheless, research indicates that active participation in treatment, you have to participate. You can't just go to treatment. You can't force somebody to go into treatment and make it work. You can lead a horse to water, as they say. One idea that I've come up with is not myself, but as a group, a culturally based safe house, a drug treatment space for pregnant mothers, a drug treatment intended to help addicted individuals stop the compulsive drug-seeking behavior and use, treatment that can occur with a variety of settings, such as like a garden, so you can get grounded into the, back to earth, Mother Earth, putting in a alkaline water system in your sink, installing that kind of stuff so you're aware of the water that you're taking into your body, putting your love and stuff into the gardens, building an earth lodge, building corrals for your animals, sewing, beading, doing things like that, having a safe house for mothers who are addicted, but make them go there. Yes, it's kind of like a detention or a prison kind of action, but it's not. It's going to be holistic and a culturally based program. And because if we look at it right now, all of the babies that are being born in Indian country addicted to fentanyl, any kind of opioid, alcohol or, different things, even diabetic. Diabetes is actually showing up in our kindergartners. We have kindergartners with diabetes now. So if we actually implement these kind of protocols or these programs to re-indigenize our bodies back through traditional foods and through traditional doings, that our people will have a chance. Because right now, as it stands, our tribe's going to be dead in 50 years. All of our tribal members are going to be mentally challenged, emotionally challenged. They're not going to have the facilities or the capacity to run anything, let alone their own lives. So I'm going to be doing we're actually working on some resolutions and some reforms on how we can help pregnant women with addiction, because it is important to understand that these mothers who are actually essentially killing their babies and breeding incapable human beings, it's not necessarily their fault. Yes, they made a choice to start doing drugs. We all know that's a choice. However, We need to understand that once you're addicted, you don't have consent. You don't have the ability to say no. You don't have the concept of, am I doing the right thing? Because all you want to do is get to that next high. If you ever heard of the law of attraction, I live that now. I live the law of attraction way. One thing I learned is that heroin addicts are the best manifestors of the law of attraction. I think there's actually a study. You should look it up. But I'm going to do a live again, and it's going to be about solutions and the resolutions. And if you have any ideas, or if you have anything that you would like to see as far as the social service systems in Indian country, it's not just our tribe that has dropped the ball, and just the horrific stories. I have, oh my gosh, the stories, it's horrible. And for the people who sent me your stories, thank you for sharing your stories. I'm so sorry I'm so sorry. I'm so sorry. And I'm sorry for myself, because now I have 2 children in this MHA social services system. And the way it stands, the mother she was actually caught selling the fentanyl pills. And she still has rights after she made this baby addicted. This baby has NAS. And social services, I was calling on them for months to do something. But my rights and the people who want to fight and love that baby, they're not heard. And that's really sad. But that's okay. It is what it is, right? Let's not let this happen to another family. Let's stop this from happening to anybody else. If those people in the social services on our tribal reservations can't do their jobs, let's find some people who can. And if we can't, then let's form societies in our own tribal sovereign nations, our own territories, our own regions. Let's bring forth societies that will bring forth healthy, unborn tribal members, and empower these women. Don't judge them. Yeah, it's a catch-22. It's a catch-22. But you don't understand, you don't know until you go through it yourself. I don't judge this woman. I actually feel sorry for her. I feel sorry for my son. I feel sorry for my grandchildren. What's done is done. We can't do anything about it. But we can do something for the ones that are still not even here yet. So stay tuned for the next live, and we'll be focusing on that. And yeah, Sherry, it is a catch-22, because what do you do? You know what? It's tough. But if you haven't, like I said, if you have any ideas on a resolution, like what you would like to see, what kind of reform, we have a pretty good idea. I mean, we have some good resolutions already. We have 27 specific stories, different people with stories about horror stories. Some of them even involve deaths because of it's horrible. So we're going to do something about this. I'm not going to stand by and let any more of this happen. I'm not. Because that would make me just as horrible. And I'm not. I'm for my people. I'm for our future. I'm for our people, because our Indian people deserve to live forever. We can't let the colonizers win. You know what you're doing? When you don't take care of these unborn natives, the babies born addicted, you're helping the colonizers. You're helping Andrew Jackson with his Indian Extermination Act back in 1700s? I don't know. You're helping them win. You're a colonizer yourself. Anyway, this is just a rant from an angry grandmother who has had enough of drug-addicted babies. And I'll talk to you guys again. Remember, ideas, send them in, and we'll talk again. You guys have a good day.